Hello everyone, my name is James and today we'll be walking through the standard open procedure for a surgical cricothyroidotomy. Remember, when performing a surgical airway, there are 3 approved methods by the committee of TCCC. Whichever method you prefer, it is important that you remain proficient and you practice prior to performing this procedure on an actual casualty. You'll use the head tilt chin lift method. Once the surgical cric is indicated, you will start by preparing your equipment. Inflate the bulb with 10 cc's of air, looking for any leaks. Ensure you have your scalpel close by. From there, with your non-dominant hand, you'll place the larynx in between your thumb and first finger and then palpate for the cricothyroid membrane. Once you have your site selected, you'll prep with either an alcohol wipe or iodine. And again, stabilizing, this can move quite a bit, so you need to apply a little bit of pressure and make sure that the head is nice and extended. From here, we'll make a vertical incision from the top of the cricothyroid membrane to the bottom. And so, as you apply enough pressure, that skin will naturally fillet open, and then you'll be able to see the cricothyroid membrane. With that, you'll make a horizontal cut, and you will place your trach hook. And I'm using anterior pressure to open up the trachea, so that way you can visualize the trachea. From there, you'll grab your cric, place it in, pushing posteriorly, and as I insert the tube into the trachea, I remove the cric hook. Once the cric is inserted, you'll go ahead and inflate the tube with 10 cc's of air. So once your tube is in place and you've inflated the cuff, you look at the tube, you confirm if you have misting on the tube or bilateral rise and fall of the chest. If the patient is unresponsive, if you have someone to help you, you'll secure a BVM and use a stethoscope. You'll listen to the epigastric region as well as visualize bilateral rise and fall of the chest and listen to both lung fields. Once you've confirmed a compliant airway, you'll go ahead and secure the tube to the patient. And once you've secured your cric, you will reassess your intervention, monitor SpO2, and document all casualty care on a DD Form 1380.